What about adverse side effects to medications, Doc?
Well, unfortunately, that comes with the territory. The nature of any medication is that it has side effects. So the idea is to try to minimize them. So the first thing to do is to find a practitioner who really knows what they're doing. Find a good prescriber. Do you know that 80% of the antidepressant drugs are given by general practitioners, your family doctor? That is not their specialty, you know? So you were lucky. You found somebody who was a psychiatrist who'd been in business for a long time, who was really, wouldn't you say, incredibly knowledgeable. And so they're psychiatrists and they're nurse practitioners, two good options. So make sure this is all they do, because there's so much information and so much to know about psychiatric drugs. If that's all they're focusing on, they're going to be a lot more knowledgeable. Also, the other thing to do is to basically know if there's any contraindications, especially if you're on other medications that might, interfere with it or react adversely. And the third thing is to start slowly. When I had my horrible reaction to a drug that sent me right into the hospital, it's because the doctor put me on too high a dose to begin with. If you're someone who's really sensitive to drugs, alcohol, have a sensitive nervous system, someone who's known as a quote-unquote highly sensitive person, you should take the starting dose and cut it in half. It's called, gradually tapering up. There's another word for it, I can't remember at the moment, but basically you start really low and go up titrating. That's what it's called. You're going to titrate. And so, don't believe what the drug companies tell you. Start lower than they say, and you'll always work yourself up to the right dose. So that's a good way to get started.
Awesome, thanks. How should I deal with my resistance to taking medication?
This is somebody that everybody deals with. I don't want to be dependent on medication. Well, I have good news, bad news. The point is that you are already dependent on oxygen. You're dependent on food. You're dependent on, when you were an infant, you were dependent on your mother, right? So we live in a world where we are dependent and interdependent. So this idea is, I'm wearing contacts right now. Usually I wear glasses. I am so bloody nearsighted. If I didn't have any, visual aids, I'd trip over my feet before I got out the door. So we have to accept that sometimes we need outside help, whether it's from people or from substances. So, and again, if we look at my good friend Stuart, he just was diagnosed with type 1 diabetes. He doesn't take his insulin, he doesn't live. So sometimes it's not that extreme with antidepressants, obviously, but you get my point. We do need to be dependent on things. And then remember that this drug is simply a means to an end. It's not the end itself. Because all these other tools I talk about in my book and my website that we're talking about in this video series that you can use to stabilize yourself, this is just like a catalyst, a boost to get you out of the pits so you can use the other tools to get yourself better. It will never be the primary thing for mental health recovery, the drug, but it will be one tool, one help that will get you there.
Awesome.
And by the way, when you're done, when you're feeling better, you can always taper off. So tell yourself, this is just a tool, this is just for right now, and I don't necessarily have to be on it forever.
Okay. Awesome. What questions should I ask about my antidepressants?
Okay. I've went to some of the best psychiatrists and nurse practitioners in Portland. I compiled a list I have in my book. I just wanted to go over. There's only a few things I want to read. Okay. So again, the name of the medication, what is it supposed to do?
Right.
What's its purpose? And when and how often do I take it? Do I take it first thing in the morning? Do I take it at night? Some of the activating medications, like the SSRIs, you don't want to take it before sleep because they could really disrupt your sleep. You want to take them in the morning, but let your doctor tell you when to take it. What, if any, food, drinks, or medications or activities should I avoid, right? Some of these older drugs, the two of them, Nardil and Parnate, they react very adversely with wine and cheese and certain types of foods. Again, there are certain foods that don't go with certain drugs. What are the potential side effects and what should I do if they occur? It's really good to know ahead of time what they are. By the way, sexual side effects or lack of sexual interest is often a major side effect of these drugs, which I know is a pain in the butt for a lot of people. And I don't really know if they've figured out what to do about that, but usually, again, those will go away. And again, if you have other information about the medication you can get online, it's really helpful. There's all these sites that have really good information about the drugs. So, to be informed is to be prepared.
Awesome. What if the medication doesn't work?
That is a really frustrating part of taking these medications because only about, I'd say, half the time do they work right off the bat. Sometimes you have to increase the dose. Sometimes you have to add something else. Sometimes you have to switch. So again, it's being patient, being patient, being patient. And if you go through many courses over a long period of time and nothing works, don't give up, because there's a new treatment out there that you and I talked about, actually used to use once. It's called transcranial magnetic stimulation. It's changing the brain, not just using chemical stimulation, but changing the electrical field of the brain using magnets. It's kind of like electroconvulsive therapy, but not as invasive, and it doesn't do anything with your memory. And by the way, for people who are really seriously depressed who's watching this, and people who are really on the edge, maybe even suicidal, ECT is helpful in 90% of the cases. It saved my mother's life numerous times. So there's a lot more things out there than drugs, and oftentimes, your viewers should know this, depression is usually time limited, which means if you can just hang in there and tread water, sometimes it'll just clear up spontaneously. So the point is to never give up, and don't give up 5 minutes before the miracle, because I have never, in the 13 years I've been doing this work, and you can attest to this because you've been in my groups, everybody who hangs in there eventually does get better. You will get well.